I'm Lori Clay. I teach at Arkansas State University. I'm actually the Clinical Learning Center coordinator for the university. I've been in that role 2 years. So, taught for 16 years in nursing, and in the last 2 years I decided to go 12 months and coordinate our Clinical Learning Center, which is brand new. What's interesting is when I went to work at Arkansas State University, actually I taught in a community college for 11 years, left the area, lived in Georgia, and then when I moved back I applied for a job at Arkansas State, which is where I graduated from. And so as a result of it, they had a VitaSim as well as a virtual IV, and nobody was using it. And I was curious, and I tried to turn it on and figure out what it did, because I was teaching health assessment and foundations and didn't know anything about it, and decided to call our Laerdal rep and say, hey, can you come help me figure out how to turn this mannequin on and work virtual IV? As a result of it, I actually got to go to a conference at UT Arlington to their virtual hospital, and from that I developed some simulations just very, very basically. While I was there, Donald W. Reynolds Foundation, we had this wonderful multi-million-dollar grant, and we got to have a new clinical learning center, and they asked me to coordinate it. So, yeah. I've been teaching nursing for a long time, so we pretty much had static mannequins, and when our students would come in, we would talk for them. Like, they would have to talk to the mannequin and we would answer. Well, which was not very realistic, but worked. And now I actually importing the vocals, importing the media files, taking something as simple as a blood transfusion and having a blood transfusion reaction, and being able to involve family members, have students to work together as a team, and to take the faculty out of that and let the students work independently. That is the amazing part to me. And the attitudes of the faculty are now that you can take the content that we used to teach in a theory room and actually put it into your simulation. So to me, what we're seeing is it's teaching at its best. And that's the way I look at it, is I actually get to get in there and the students have active learning, which is what I've been trying to do for a long time. And to me, simulation just provides that. When my students leave and they've done central line care in terms of simulation with the high fidelity mannequins or standardized patients or low fidelity mannequins, it's creating that realism and allowing the independence of the students. Well, number one is that the students beg for more simulation time. This is the one experience that they want to come back to, and they ask for more. When it's time for it to be up, they're not ready to go, and they actually like, what, sim lab's over? When do we get to come back? And so I think we're going to have to look at putting more clinical time into that, because I can guarantee you in a day in sim lab, I can guarantee you when I want to in patient care. I can absolutely guarantee you that. I can't do that when you go to the hospital. I can't pick those patients for you. And I really see that by the time they progress, if you start with them when they're sophomores and they progress, then by the time they're seniors, you know, one of the things I'm really looking at, and I know it's a big controversial area and there's a lot of research on it, is testing. By the time they get to be seniors, I think it's time to turn that environment into a competency testing environment. And I think that's one of the things that I see me wanting to move towards, is that, but I'm so new in it that I don't want to put my cart before my horse or look before I leap. So I think that's where I see it going. I just think we're going to have more and more because of the way that our students learn. Actually, my first was a mini son that was at Arkansas Children's Hospital, and it's because I had a new position, and then I found out and got invited to the Dallas Sun 2 years ago. Absolutely loved it, knew nothing. And so, of course, this time, I missed last year, and then this year I submitted an abstract so that I would get to come, because I love the networking. I love the fact that it's not just nurse educators, but it's people from all, you know, different realms that are in simulation. And so my favorite part, honestly, is the networking part. It's really why I come, besides just some fabulous information.